This is Dr. S.M. Goel, MD Medicine and DA Medicine also. I am from a family of doctors from All Institute of Medical Sciences and Delhi University, and we are four brothers physician, and we are married to four doctors also. We came to England and US, and we have been here for last 30 years. My this video is about the risk. This video and subsequent videos are about the risk factors for the heart attack. As I mentioned in the previous videos, the most important, all the top medical bodies have, especially cardiologies, that there are nine, risk factors in order of importance. Most important factor, and every factor is important, but the number one is really number one, which is really a very high risk situation. So, so I mean, so once again, I wanna remind you that you may say that my family has a strong family history of heart attack, but genetics is only involved 10%. All these studies have shown 90% factors, which are risk factors, which I'm going to mention, are modifiable. You can control them, you can manage them. So let me tell you is the first risk factors is most important risk factor is cholesterol, bad cholesterol is called LDL, low density lipoprotein. There are two kind of cholesterol. When I'm saying bad cholesterol, obviously there is a good cholesterol. So good cholesterol is HDL, high density lipoprotein. So whenever we doctors talk about cholesterol or high cholesterol or controlling your cholesterol, which is a sticky substance, fatty substance, we talk about LDL. And actually, all the medicines we give you to manage the high cholesterol, they control the LDL or the bad cholesterol. So I also want to tell you only way to increase HDL is by exercising for now. So let me put it this way. The bad cholesterol, what does it do? It is sticky and it clogs our arteries, especially. And now we're talking about the heart, so it clogs. It is the one which, with time, if your cholesterol remains high, it starts clogging up or blocking the arteries or blood supply of the heart. There are three main arteries, two become three. They supply all the blood supply to the heart. And usually, in a big picture, the heart attack is when this plaque or cholesterol plaque or the L plaque or bad cholesterol plaque breaks up, goes and then blocks the part of the and they cut off the supply to part of the heart, and then you have a heart attack. It may be minor, it may be major. Um, so So cholesterol is essential for life, no question about it. We need cholesterol, but high cholesterol, the bad cholesterol, high bad cholesterol is eventually can lead to what I described, the heart attack. Um, so let me tell you a story. One of my friend who is a cardiologist, and we're talking about it. We're sitting, chatting, joking around, and he says, he just jokingly says, "Ki these days my business is not as good, you know. So I say, what's happening? He said, nobody's having a heart attack. And this is talking about the US. I say, why is that? Because he said, everybody's taking statins. Statins are the medicine which are, unbelievable, very safe, very good, dramatic. Statins. Atorvastatin, there's all they're called the several groups. There are six or seven medicines which really help to control your LDL or the bad cholesterol. Uh, Top medical bodies, they recommend we should keep our cholesterol less than, 100. But I will say the best is we should shoot it to keep our bad cholesterol around 60 and 70. Whenever you get your blood test done, you get cholesterol profile, please look at your cholesterol, LDL or the low density lipoprotein. We call it bad cholesterol. And NHDL should be more than 40. We call it a good cholesterol. What do cholesterol is actually it is other way around. If your drain is blocked and you put something in the drain, in water drain, it opens up. This is what HDL does. It actually dissolves that plaque and washes away and keeps our heart arteries open. Why do you imagine the cholesterol deposits in the blood vessels for the heart? It does everywhere. It does in brain also. It does in kidneys also. Everywhere. But heart attack, obviously, heart is one thing which can, if you have a heart attack, we can lose in our life in 5 minutes. So all of us, all the top medical bodies have decided this is the single most important risk factors for the heart attack. It's a very slow process. So and all also there is no question that 18 and older every year you need to have gold standard blood tests, and please make a folder and save your blood tests. When we follow them over years, your blood tests, they tell us so much about you. These some of the healthy indicators of the our health. They are, when we follow them and they remain constant, they remain okay, normal, we can see, that helps us a lot to indicates your health status. And anytime things start going in one direction or other direction, we can modify it, we can manage it, we can educate you, and that's the way we keep you healthy. And I will talk about the second factor in the next video. Thank you.